Hey, Chani Maneker, developmental audiologist here. That means I help you facilitate development and optimal learning. Let's address the pink elephant first. You may be wondering why a developmental audiologist is talking about parenting rather than hearing and listening, like most audiology channels. Great question. I'm on a mission to make the learning process easier. As someone who is trained to deal with the hearing impaired, I was taught to focus on listening as a communicative relationship between listener and speaker. Each one has their role and responsibility for successful communication. It occurred to me that education, at its core, is a communicative event with a speaker and a listener. In this situation, we want the educator to be the main speaker and the student the listener. I help improve the education process by doing assessments at the Hearing Kids Clinic to see how well the listener's physiological function, their body, serves them to listen. And I do parent and teacher trainings to help these educators be better speakers by providing an understanding of their audience, the individual student who is not understanding what the educator is trying to communicate. Let's imagine, if you will, that you were speaking to somebody who's British, but didn't know it because they adopted the American accent so well. The subtle language differences would make for some very interesting, unexpected outcomes, and you wouldn't know why or how you need to adjust without learning this person is really British, or Australian, or African, right? There are actually a lot of countries that learn English, but with subtle differences. And if we don't have the expected cues, we don't know how to fix the problem. Well, if you aren't getting the results you expect when educating your child, be it as a parent or a teacher, then something is getting lost in translation. My trainings are to help you recognize these cues, these red flags, so you know where to look and what to look for. So let's get started here by looking at what expectations you have and what knowledge and beliefs you have about parenting and child development. So the question here was, how do fine motor skills develop in children? And the possibilities were, randomly, from distal to proximal, or from proximal to distal. And the answer is from proximal to distal. So what is proximal and distal? And who cares? Proximal means closer to point of origin, while distal means distant. For example, your shoulder is proximal to your trunk in comparison to your elbow, while your elbow is distal to the shoulder but proximal to the trunk compared to your wrist. Normal development occurs proximal to distal. So you're probably familiar with core strength and know that it's important, and may not be clear on just why. Core stability allows for healthy use of more distal parts. This function develops in a proximal to distal fashion. So you can keep an eye on your child's development by watching if the body parts they are using evolves in this sequence. So as an example, using their legs before using their feet.